Welcome to Power Up Recovery with Nutrition. It is time to make nutrition part of the conversation. I'm your host, Christina Veselak, and I'm so glad you're here. Did you know that it's our brain's job to allow us to cope with stress gracefully? But to do that, it needs to be fed optimally. Have you ever wondered why so many committed people relapse or maybe even die? Why so many people on psychotropic medication still feel lousy and still have cravings? What if the missing piece is food, the right food? What if the right nutrients like amino acids or even eating protein every 4 hours could actually balance your brain chemistry and your mood without medication and support lasting recovery? In this podcast, we explore the powerful connection between feeding your brain well, mental health, relapse, and recovery from addiction. We will share insights from experts, inspiring recovery stories, and practical strategies you can use today. Whether you're in recovery, a healthcare professional, or someone passionate about emotional well being, this show is for you. Let's dive in and discover how fueling your body and brain with the right food, the right amino acids, and other key nutrients can fuel your transformation today. Welcome. Hi, everybody. Welcome to the next episode of Power Up with Recovery with Nutrition. Today, I'm welcoming Julia Ross, who is a dear colleague of mine and who is the person most responsible for getting me on this road and getting us all here today. I first met Julia Ross somewhere around 1990, I think. I had been a addiction counselor for a while, 5, 6 years, and I was beginning to feel frustrated at the limitations of what I was taught. I'd always been interested in nutrition. And when I saw this press release that came out talking about this outpatient treatment program using nutritional approaches, I was very interested and met Julia and learned about amino acids and was hooked for life. So here we are. Welcome, Julia.
Thank you, Christina. I'm glad we're still connected.
After, let's see, 30 years, 40, going on 40 years. Hey, that's a record. So, Julia, could you please tell us a little bit about kind of who you are, what you're doing now, and then how you got to what you're doing now? Because it's quite a journey.
Well, that's a tall order. What I'm doing now is running a training program for health professionals like you who didn't perk up 40 years ago, uh, but are now realizing that they're burning out because what they're doing isn't working.
That's right.
So they're coming and, I would say in the first month, they're starting to see the immediate benefits that these techniques are adding to what they already do. So that's a lot of fun. I'm doing quite a bit of mentoring in the program and going over cases with them and so forth. So I'm really enjoying that.
It
And
is
then
fun, isn't it?
it is.
Yeah, I really enjoy watching how people grow and they're so enthusiastic and they're getting such amazing results using amino acid and nutrient therapy that they had no idea they could do before.
That's right. They took their money in their hand and leaped into the training, not really believing, could it really be this good?
I
But I
know, I
have to
know.
say that the majority of them were trying the amino acid techniques on themselves after reading the books, and they got some kind of benefit and realized, there was something to this, and they could take that risk. So we're having a good time with that. And then some of them opt to do an internship. So we have our virtual clinic, and
Hmm.
they can sit in on the sessions with the permission of the clients and
Nice.
over time take over themselves. They
Yeah.
observe and then take over. So I get a big kick out of the whole thing. And because I'm not doing direct counseling myself anymore, this is the way I stay in touch with how extraordinary these methods really are in real life. So that's what I'm doing now. But as for how I got here, like you, I was a psychotherapist, sort of stumbled into the addiction field in a beautiful nonprofit in a four-story Victorian on the Hill in San Francisco. None of us, we were all interns at the local master's program in psychology. None of us knew what we should do. There was no model at that time. We're talking about the mid-1970s. AA, was really the only sort of acknowledged, means of support for addicted people. And most of our clients were alcoholics. It was before the other drug addictions started to hit. So this was a residential program long term. We had some people who had been there 5 years. So lots of support. We created the most beautiful therapeutic milieu, as we called it then. We had programs for families.
Therapeutic community.
Yes, therapeutic community, the families and the recovering people. It was a very rich, exciting time. And it lasted until the 1980s. So about 5 years, we had a great time and felt like we were, successful. When the first follow-up studies came out, they were showing back east, where a therapeutic model had been developed and had been running for about 10 years, they were having about 50% success. And we knew we were having a better than that because we provided long-term residential support as long as needed. So that was all very exciting. But here's what happened, and I know this is what you were getting at. We ran face first into the crack cocaine epidemic in the mid 80s. So we've been seeing some cocaine addicts, high end professionals who were pretty easy to treat, but crack cocaine was a completely different world. This is what we experienced. And this is what everyone in the addiction treatment field experienced at that time in the mid 1980s when the crack cocaine epidemic hit. And that was 100% rapid relapse rate within 24 hours. They would come in and within 24 hours, they'd be gone. And so we had, eventually we had to face the fact that we were up against something we didn't know anything about. None of our techniques worked. The 12 steps didn't work. And frankly, there was a nationwide depression among the addiction treatment professionals at that time.
That's right. Which is really, if I could add, really similar to what happened 15 odd years later, 20 years later, when the opioid epidemic all of a sudden burst on the scene.
That's right.
And we're relapsing right and left.
That's right. And that's why we're having this conference, is to assure people that we have developed successful techniques decades ago.
That do not require medication.
No. And the way we discovered this was, in our case, in San Francisco, the local most well-known treatment program was the Haight-Ashbury Free Clinic, which was developed to treat heroin addicts and help them detox way back. And suddenly they were getting 100 cannabis addicts a week banging on their door. And then when they'd finally gotten that under their belt, the crack cocaine epidemic hit. And they were experiencing the same thing we were. And David Smith, who was the MD in charge, was friends with the neuroscientists at that time who were studying addiction and the brain. And he asked them to come and talk to us about what they were learning and what it could add to what we were struggling with. And one of the neuroscientists, all of them were fascinating. And they told us that, yes, the brain is the site of the genesis of addiction. And one of them said, and we know how to correct the brain dysfunction that causes addictive cravings. And he proceeded to do some studies, which he told us about, the earliest in the 1970s. He went to in the local cocaine treatment facility, which is in a hospital near the university where he was doing his research. They were having 40, all of the cocaine addicts who came in had to pay $10,000 that was non-refundable before they stepped in to the unit. And Dr. Blum, Kenneth Blum, asked them what their retention rate was. And they said, well, even though they have to leave the 10,000 behind, 40% of them leave within the first 10 days. And Ken said, let me make you a proposal. Would you give all of your incoming clients for the next 3 months a supplement, a harmless supplement that's known to assist the part of the brain that is struggling to generate natural stimulation and energy, the part of the brain that cocaine gravitates towards and basically destroys over time. And like us, the therapeutic unit was desperate, and they said, fine. So at the end of 3 months, they calculated their AWOL rate. And, what they found was that their AWOL rate had gone from 40% to 4%. And the only thing that was new was the amino acid tyrosine.
Yep. Rebuilding those catecholamine neurotransmitters really, really, really quickly.
So that word spread. And like everyone else, I thought that is much too good to be true. But I'm interested in nutrition. And most in the 70s, everyone, who was an advanced thinker was interested in nutrition. And I contacted a pioneer in the Midwest, in Minnesota, Joan Matthews Larson, who wrote 2 fabulous books and was ahead of the curve. And I asked her, have you tried this tyrosine? It looks like Dr. Blum tried it, about 5 years ago. And it seems to be very effective, but is really? And she said, let me send you a transcript of a talk I just gave about it. And in the talk, she gave chapter and verse on using it in her intensive outpatient program with just exactly the same kind of immediate success that the Dr. Blum study showed. I had a nutritionist on staff. She was recommending a better diet, but of course, our totally destabilized cocaine addicts could not get the food organized. We were an outpatient program, so we couldn't supply it. But she knew about supplements. I asked her to research tyrosine, and if it was safe, can we start it in 2 weeks? And she said yes. And she came back in a week and said, no problem. I have ordered it. Let's just talk to our clients and see who is willing to volunteer. And we got a volunteer right away. He said, oh, I'm not afraid of amino acids. I was a bodybuilder before I got into crack. And we used, amino acids all the time. So we gave him amino
Slightly different ones.
He was taking the whole array, not the concentrates. So we gave him the concentrated tyrosine, one of the 20 amino acids found in food, and told him to take it, accept it in the evening, several times a day, and to come back in a week. And when he came back in a week, he said, this is the first time in 5 years that I haven't had cocaine. And in a whole week, he talked about some close calls that he'd had, but he said, my craving was so reduced that I could just pass when it was, offered to me. And we never looked back. And that was 1986.
Amazing.
And it's continued to be amazing.
Well, yes. And of course, tyrosine can be used for so much more than just stimulant addiction. I remember when my doctor first recommended it to me, I don't know, somewhere around 1990, somewhere around the time I met you. And I had, deep, dark, slow, sluggish depression and undiagnosed ADHD and she said, I'm just learning about this amino acid tyrosine, which I had learned about from you and from Don Tyson, who was distributing it. And she said, I want you to take 1,000 milligrams 3 times a day before 3 o'clock and report back to me in a month what's happened. Well, in a month, I called her and I said, it's just not working. And she said, well, are you taking it, you know, every day, 3 times a day, the way I told you to? I said, no, I can't remember. Okay, undiagnosed ADHD here. And then I asked, can I take it with food, do you think? She said, well, she didn't know that much about it. I guess so. It's found in food, so I guess you can take it with food. So I could remember to take it with food, right? Breakfast, a rising breakfast, lunch. Okay, I can remember that. And I called her after a month and I said, it's working. The sun's come out. I'm happier. I have more energy. And I could probably remember, I was probably thinking in more of a straight line too. Um, and I did not stop taking it for at least 10 years, probably 15,
Uh-huh.
because it was that effective. I'm one of these people that I needed to be on the aminos for much longer than most other people did
Well, I'm
because of
glad you mentioned that because
a variety of
one of the
reasons.
selling points of amino acid therapy is that most people get benefits within 24, 48 hours. And depending on the severity and type of addiction, they
Right,
can give it a rest and start tapering one at a time within 12 weeks. Um,
exactly.
but uh, we did find that with our drug addicted clients, oftentimes they came from addicted families. So
Yeah,
alcohol addiction usually ran in the family tree. So they had a more complex and a little denser addiction and brain dysfunction that needed more time. But
exactly.
I remember we had a number of them speak in a TV special on the amino acids that
Mhm.
Dr. Blum set up, and they were saying none of us are still on the aminos. It's been a year;
That's
we
right.
don't need them anymore.
That's right. That's
And
right.
that's very important to know. And some people, if they took them as long as you took them, would start getting headaches, some kind of adverse.
Some
Uh,
some kind of adverse. And I think of it, Julia, as how open is the drain in your bathtub? If in recovery people are able to seal up that drain, and so they're just be able to rebuild their neurotransmitter stores, start eating properly, start moving out of stress, and then their brain can take over rebuilding the neurotransmitters themselves, keep it going. I had undiagnosed celiac disease for 30 years and was profoundly nutrient deprived and had PTSD and had ADHD. And so
and you
my
probably
background
had some genetic components
and
too, right?
and some genetic components. Exactly. I didn't have addiction. I just had all this other stuff going on. And so it took 10, 15 years, little by little. I actually had 10 other biochemical drivers of my depression, not just low dopamine. And so for me, it took a long time to seal up all those cracks, rebuild my gut, restore my nutritional status, deal with the ADHD, deal with the trauma, which was, acting as a drain on my neurotransmitter system because of the chronic stress. And finally, I got to the point where I didn't need them anymore.
Bravo.
Yeah. So this is what's so wonderful about nutrient therapy and amino acid therapy is that we get to individualize it. We get to trial it. We get to use your wonderful amino acid therapy chart, which is a neurotransmitter depletion assessment tool, right? It tells us specifically what neurotransmitters need support. And then I tell my clients to stick it up on their refrigerator door,
Uh-huh.
memorize it, so that then they can track what they need and what they don't need for the rest of their lives.
Well, I'm glad you brought up the chart and this individualizing beauty of neuronutrient therapy, um, because most people only know about the neurotransmitter dopamine. They don't
Right.
realize that there are three other major mood and appetite regulating neurotransmitters that are typically also depleted. You may be a cocaine addict, and we know right away which um, which of these stimulating neurotransmitters needs the amino acid therapy to rebuild. But we have alcohol addicts, we have cannabis addicts, we have benzodiazepine addicts, we have opiate addicts, and each one of them needs something different. And many of them, especially the alcohol and cannabis addicts, need some or all of the neurotransmitters repaired.
That's right. That's right. And, we've seen such poly drug addiction over the last 30, 40 years. And I think this is because people have such starving brains, such depleted neurotransmitters. Increasingly over the last 4 decades, people have more and more nutrient deficiencies because, of what's happening to our food supply, and which you'll talk about in a minute.
Great.
Um, that we need to be rebuilding all the neurotransmitter systems, maybe all at the same time, maybe one at a time, but for people to have full remission of symptoms. Right. And of course, we know from Dr. Blum and his theory of reward deficiency syndrome that all the other neurotransmitters impact the firing of dopamine in the nucleus accumbens, the pleasure center of the brain anyway. It's not just one neurotransmitter system all by itself, right? They dance together.
And he learned that as part of the team that discovered how alcohol affected the brain,
Mhm.
and wrote a wonderful, enlightening book, uh, Alcohol and the Addictive Brain, published, in the by the mid 80s, which talked about, oh, alcohol affects dopamine. Oh, it also affects our natural tranquilizer GABA. Oh, it also affects our natural opiate system, the endorphins.
Mhm.
Um, and and of course, it also affects the blood sugar
That's
balance
right.
in the brain and body. And there's a marvelous amino acid that corrects that. Um,
That's
so
right.
he was one of the early neuroscientists who was educated about what nutrients supply the brain.
Mhm.
When scientists study muscle, they study the amino acids that compose muscle. In the case of the brain, they want to know which nutrients are needed to build this incredible
That's
structure.
right.
And it turns out that to build and maintain these four neurotransmitters that make us happy and keep us satisfied with healthy food, um, we we only need a few nutrients, a few specific
That's right.
nutrients, so
That's
that
right.
even though it's miraculous, it's very simple, it's inexpensive. These are nutrients you can get at the corner health food store, uh,
That's right.
and,
Or from Amazon.
of course. So he was operating before 1989, and one of the presentations that you're having me make at the conference is about the history of nutrition and addiction. And I'm just going to give a hint that it was thriving until 1989. And I'm not going to go into detail, but I can just tell you that the turning point was when the pharmaceutical industry released its first antidepressant and found that the amino acids were so well known and effective that they weren't making money.
That's
More
right.
will be revealed.
Oh, it absolutely will be revealed. Now, your first book, though, that's like your first book and your last book was about food addiction.
Right.
So
And it
can you?
turns out that, it started because I was an eating disorder specialist as a psychotherapist.
Mm,
And then I became an addiction specialist. And then I was dealing with both and realized it took me a long time, I'm embarrassed to say now, but that uh, all of our clients who were struggling with emotional eating, typically in recovery from some other addiction, alcohol,
right.
pot, cocaine,
They
whatever.
just switched addictions.
That's right. I finally realized, well, if the nutrients are helping cocaine addicts, maybe they could help these food addicts. Um, and sure enough, they did. Uh, but the interesting and critical thing here is that this was in the 80s. Food addiction as an epidemic was underway. So it started in the 70s with this sudden upswing of unknown incidences of bulimia
Mm,
and binge eating, anorexia, eating disorders were unknown really before that. And each decade added something specific, and that's something specific was that the tobacco industry bought the snack food industry in the 1970s, and by the 1980s they had really started to perfect the techniques for making their snack foods addictive. And that's only increased over time. But I'm certainly going to be talking about that in my presentation on food addiction. And at this point, food addiction is the number one addiction in the world. It is more deadly than all the other drug and alcohol addictions combined,
mhm.
because it is the direct cause of diabetes, obesity, and the other diet caused cancers, liver disease. So, fortunately, my experience starting with crack cocaine and now specializing in food addiction is even easier than crack cocaine addiction to get over. And
Once you figure out which
that's
neurotransmitter
right,
sugar and the starches are actually firing, because it could be any one of them, or
or
all of
all
them,
of them.
or all of them.
And usually it is more than one. You don't get such a deadly addiction sticking the way it does, food addiction does, unless there is very extensive neurotransmitter dysfunction throughout the brain. Um,
Exactly.
but
Well, and we see that with alcohol, we see that with THC, and we see that with nicotine, which are
true,
these universal addictions. And every single one of them fires whatever neurotransmitter is struggling in the moment, right? Or all four, or one in the morning and one before bed,
that's right.
right? And this is why they're so ubiquitous, is because they fire across the board as needed.
So the food industry thought they had us trapped, and they were right to think that.
Yeah, yeah, yeah.
Uh, But they had to do in the history talk. I'll talk about what they had to do to suppress this nutritional approach and how it's surging up again. And we will have some very interesting announcements to make about how interested the new chair of the Health and Human Services uh, is in this approach. And
Exactly.
Make America Healthy Again really sees nutrition as front and center. And
That's right.
so I think we're looking for some very exciting expansion of what we've done in the next few years.
I think so. And maybe a lot more support than we've gotten thus far.
Oh, we
Because
couldn't
of
have had
course,
less.
this research goes back to the 50s and earlier. We've known for decades, Julia, the nutrients the brain needs to function optimally. And I mean, if you go back to the studies on pellagra and beriberi and scurvy, right? We've known for decades the nutrients the brain requires. And yet that's never ever become part of the mental health or addiction treatment conversation. And
No,
that's where the tragedy That's where the tragedy is. You and I, when we were in school, we were never taught that we can actually do something as ordinary people to affect the health of our brains and our moods ourselves. We
No,
were
that was
taught,
way beyond us. The brain was sacrosanct and way too complicated and powerful. And
that's right, you had to refer everybody who had a biochemical issue in their brain to a psychiatrist for medication. Even when we were going through school, there weren't that many medications.
right.
Right? Without still the only option given us. And it's still the only option given psychotherapists and psychiatrists is medication, medication, and more medication and more medication. I don't know if you see this with your students and their cases, but my students at first are very scared. How do we do nutrient work and amino acid work when people are coming in with on 10 psych meds? And I'm saying, well, you don't. You back off a little bit on the targeted amino acids, but what you do is ask them what they're eating. And what we have found is the more psych meds people are on, the worse their diet is.
Oh, interesting.
And it actually makes sense because even the psych meds need some underlying nutrients in the brain to act on, for them to function, because all they're doing is moving things around, but they have to have something to move around. And that something they move around comes from our food. So the worse people are eating, the more ineffective these drugs become. But psychiatrists don't know how to take people off meds, so they just keep adding them and adding them. And I say to my students, don't worry about it. Let's just get them eating food, real food. My kind of backbone of my approach is 20 grams of protein every 4 hours because it's easy for people to remember. Um, and just get them doing that along with other real food for a week and then redo the chart and see what happens to all the tens across the board on the chart, showing profound neurotransmitter depletion across the board. And a
Well, I
week
think
later,
it's interesting that you just keep it very simple and say you don't even approach the other things they're eating. You're just saying whatever you're eating or not eating, just add protein
just add
because
protein. Yes.
because people are so addicted to the carbs that are much more addictive than protein isn't addictive.
No,
That's
not at all addictive. It's anti-addictive because it's rebuilding, just like amino acids are anti-addictive because they're rebuilding the neurotransmitter systems, right? Rather than depleting them. So after a week, my students have their clients redo the chart, and most of the numbers have dropped by 2, 3, 4, 5 points, dropped in half in many cases. And then and then the medications start working. And then they start getting adverse reactions to the medications because they don't need them anymore and start coming off them. And we've stopped the downward spiral and we've started an upward spiral very quickly.
well, you're talking about people who are trying to get sober and they're loaded up with medications. With food addicts, they're typically not loaded up with medications. And it's one of the reasons that food addiction, although the most deadly of all addictions, is also the easiest addiction to turn off.
That's
You
right.
don't have the same kind of complexity going on. And so we can go right in with the aminos the first day. And we
Yes.
do actually trialing
Yes.
uh, on Zoom with our clients to make sure that the amino we think they need is actually going to work. And because they kick in just a few minutes, we get that
Right.
confirmation. And if it isn't confirmed, we go on to another trial of a
Right.
slightly different amino acid. Um, so this conference is going to really offer exactly what's needed across the board, whatever the substance, whether it's donuts or heroin,
Mhm.
people are going to.
Or the now ever present cannabis.
Yeah, the
Yeah,
now ever present and 90% stronger. Yeah.
that's right.
Uh,
Right.
But we fear not, because we know that we can correct those neurotransmitters, turn off the cravings, and watch our clients walk free.
That's right. And, if you could just talk to us about your middle book, The Mood Cure, because I
Yeah.
actually use that as a required textbook in my course.
So the mood cure is pertinent to this conference because it has a major chapter on called nutritional rehab about how people who are drawn to various substances of abuse because of mood problems like depression, anxiety, obsessiveness, how they can back away from the addictive substance by restoring normal neurotransmitter function. Starting to sound a little repetitive. And we're lucky that this is a fairly simple
It's
process.
a very simple process. Yep.
So the mood
Yep.
cure is entirely focused on these four neurotransmitters that not only affect our natural ability to be stimulated and focused, that you've been talking about, the dopamine um, and norepinephrine, but also our natural antidepressant serotonin is fueled by a single amino acid. Um, our naturally tranquilizing, our natural benzo called GABA is also very simply fueled by a single amino acid. Typically, the amino acid that is miraculous for balancing blood sugar, glutamine, uh, is also covered in the book. And finally, endorphin, which is our natural opiate, and is more complicated than the other neurotransmitter systems, um, but still responds beautifully to increased protein in the diet and a very special amino acid.
So don't keep us in suspense. What is that very special amino acid?
Well, it's one that viewers may never have heard of. It's called
Right.
D-phenylalanine. There are two formulations of it, D-phenylalanine by itself or DL-phenylalanine as a combination. And again, in minutes, this nutritional magic really um, raises endorphin levels in the brain very significantly. It was developed by a psychopharmacologist at the University of Chicago who
Mhm.
was being begged by the doctors on the surgical ward to find something besides morphine because the side effects of the morphine they were using were so terrible. And he did some research and he found that there was this unusual nutrient. And he got permission to do a dog study, and it was very successful. And so he got permission to use it, on a trial basis with the patients who were complaining about their morphine. Uh, and it was highly effective. He was able to cut down the amount of morphine by half.
Mhm.
He proceeded to then get a patent for diphenylalanine for pain. Um,
Smart.
so we're talking about physical pain here, but what we were using it for was emotional pain.
Yes.
Our opiate addicts were mostly not using heroin and other opiates because of medically inflicted or other physical pain. They were
Right.
using it because it turned off their suffering. Um,
Mhm.
and so does DPA or DLPA.
Of course, the DPA by itself, the FDA is squirrely about. So you can usually only get it online, but the DLPA you can, because it's a combination of both your catecholamine support, your dopamine support, that nice mood and energy uplift, along with the calming, comforting pain relief of the D-phenylalanine.
And we are talking about emotional pain relief as well as physical,
Yes.
absolutely.
Yeah.
Um, Dr. Aaron Priest didn't believe me. Actually, I called him to thank him for doing his research and giving us access to this wonder nutrient. And I said, of course, most of our clients are suffering from emotional pain, and it's, you know, even more helpful probably than it is for physical pain. And he laughed at me and said, "Oh, nonsense." Uh, and I said, "Well, you don't have to believe me, but I needed to thank you anyway." And got off the phone. 2 days later, he called me back saying, "You know what? I told my wife about our conversation and what you said about emotional pain, and she said that I was a boob, that I had no understanding of emotion, and that she did, and that we should immediately get a patent for the use of diphenylalanine for emotional pain as well as for physical pain." And they did.
And this was what, in the 80s? He
uh,
discovered this in what, the
in the
late
80s.
70s, early 80s? Yeah,
Uh, and other people then subsequently did research and used it, in the medical field. And then we began, using it off label, as it were. Um,
yeah.
so my conversation with him was in the 90s.
And isn't it tragic that it is not being used in hospitals post-operatively in place of morphine?
I don't know
Nobody knows
how.
about it.
Yeah. Well, I guess the pharmaceutical industry found it to be too competitive. And just as they found other amino acids to be too
Yeah,
competitive. And they've,
yeah,
up until now, they've been very successful at suppressing the information about the nutritional approaches to pain, but and to depression. But there's the underground, the nutritionally sophisticated and inquisitive can find
mhm,
marvelous information on the internet, and so the companies that make these amino acids are doing fine. Um,
right. And will
God
continue to
bless
do
them.
fine. Yes, yes. And this is why we invite everybody listening to join this movement and to join this revolution and to come to the conference to learn more and also to support the reality of this amazing, I don't want to say alternative, but this amazing resource that has been underutilized for so very long.
And I think on that note, we should mention that we are going to make amino acid diagnosing and trialing available at the conference so that every attendee can actually evaluate their own needs on the neurotransmitter deficiency chart. And assuming they don't have any of the well recognized contraindications, trial a
Mhm.
happy capsule under their tongue and
That's
notice
right.
the difference.
And whether you need it for calming or to help you sleep that night, or whether you need it for energy the next morning, we're actually going to have opportunities to trial sort of in the cracks and corners of the conference through the entire week, as well as the first day.
And
So
it's
we
going to
hope
be
you,
fun.
oh, it's going to be so much fun. It's going to be so much fun. It's always fun when we get to talk about inexpensive, powerful remedies that we all as human beings have access to. We're not limited. Julia, thank you so much for joining me today. And how can people reach you?
They can go to juliarosscures.com. Uh,
JuliaRossCures.com.
they'll find out about all the books and the training and the clinic, virtual clinic, and so forth.
Wonderful. Well, I look forward to seeing you in just a few weeks.
I look forward to it too.
Thank you all for listening. And please, if you liked what you heard, share this with other people and subscribe to our channel and press that little like button. Thank you for tuning in to Power Up Recovery with Nutrition. I'm Christina Veselak, your host, and I hope today's episode has inspired and equipped you with new insights and tools to support your recovery journey or practice. If you enjoyed this episode, please subscribe, leave a review, and share it with others who could benefit from the knowledge shared here. Stay connected with us for more episodes filled with practical advice, expert wisdom, and inspiring recovery stories. Remember, nutrition is a powerful tool in mental health and relapse prevention. Power up your recovery today. I'm Christina Veselak, and I'll see you next time.